Recording. Okay, well, thank you everyone for joining us for our virtual open enrollment fair session. At this time, we will go over SIMNSA medical benefits for plan year 2024. Before we get started, I would like to brief everyone on a couple of housekeeping items. All attendees are muted and will remain muted throughout the presentation. And if you have a question, please type it in the chat box located on the right-hand side of the presentation screen. Be informed that if you type a question there, everyone attending the session will see your question and your name. So if you have a question that is sensitive or confidential in nature, we recommend that you reach out to the County Benefits Division or your department's benefits ambassador. Lastly, today's webinar is being recorded, and a copy will be posted on the Benefits Open Enrollment website. At this time, I will turn it over to Matt Ogden and our presenter, Esmeralda Beltran.
Thank you so much, everybody, for allowing us to be here and join. And thank you, Nidra, for that. So my name is Matt Ogden. I am with California Schools VIBA, and I am the dedicated account manager for the County of San Diego. And as we move into the next slide, then we will discuss today's agenda. Are we able to move to the next slide? Yeah, fantastic. We're going to go over the SIMNSA product review. Then we're going to touch base on a little bit of the additional benefits that are available through VIBA, as well as VIBA's contact and support resources. And then again, if you do have any questions, please feel free to put those into the chat. We will have a Q&A at the end of this presentation that we will be sure to answer all of your questions. So as we move to the next slide, then we would like to go ahead and turn this over to Esmeralda Beltran, who is our account rep for SIMNSA. Esmeralda, it is all yours.
Thank you very much, Matt. Good morning. Thank you all for joining our SIMNSA health plan, where your health comes first. Next slide. Fantastic. SIMNSA's HMO plan provides employees with a very affordable across-the-border health plan option in Mexico. Now, this plan requires that all of your routine services must be received in Mexico on one of our medical campuses, being in Tijuana or Mexicali and Tecate, while also true emergency and urgent care services are covered anywhere in the world. We also have medical centers, as I have mentioned, in Tijuana, Mexicali, and Tecate. SIMNSA's health plan is subject to the healthcare reform mandate, including no co-payments, for an extensive list of preventative care services. It also includes other VIBA benefits, including teledoc, medical experts, wellness programs that Matt will be speaking about too later in the presentation. Thank you. Next slide. Fantastic. Now, SIMNSA's eligibility to enroll the employees and your eligible dependents, you must either live or work in the San Diego County or Tijuana and meet the following definition of a Mexican national. Who are those who can enroll in the SIMNSA HMO plan? Now, a Mexican national is a very, very broad term. So that being said, it is a person born in Mexico, a person born in another country with a Mexican father or Mexican mother, or both, such as myself. I'm a U.S. citizen. However, since my mother and father are both Mexican, that will automatically make me a Mexican national. Also, a foreign woman or a man who marries a Mexican man or woman and lives in Mexico is also eligible to enroll in the SIMNSA HMO plan, as well as a foreigner who becomes naturalized in Mexico. Thank you. With SIMNSA's HMO Mexican plan, you can also visit our website, www.simnsa.com, for more information, including our list of providers, our benefits summary, evidence of coverage, wellness information, a calendar. We have also our urgent care locations and any other additional forms you may find on our website. Thank you. Fantastic. SIMNSA's HMO plan provides employees with a very affordable across-the-border health plan, again, licensed with the California Department of Managed Healthcare, subject to the Knox-Keene Act. We really want to reiterate that everyone who enrolls in the SIMNSA medical healthcare plan must receive and requires that all routine medical services be received in Mexico. All preventative, PCP visits, visits with your specialist, all diagnostic. We have a brand new hospital as well in network in Mexico as well in Tijuana. Again, while true emergency and urgent care services are covered anywhere in the United States or in the world, we have medical centers in Tijuana, Mexicali, and Tecate. We are subject to the healthcare reform mandate, including no co-payments for an extensive list of preventative care services, including VIBA benefits that Matt will talk about later in the presentation. Next slide. Fantastic. Now to cover the SIMNSA HMO plan that the County of San Diego offers. This plan is the 710-250 medical plan. There, for your benefit summary, you will see there on your left that with this plan, it is a very unique plan as there is no deductible on the SIMNSA HMO plan. The medical out-of-pocket maximum per individual is $6,350. The medical out-of-pocket maximum per family is $12,700. The RX out-of-pocket maximum is not applicable. There is no health reimbursement account on this plan. For your PCP office visit and your specialist office visits in network in Mexico, there is a $7 copayment. For preventative care, there is no charge, no copayment. For inpatient hospital care in Mexico at our hospital in Tijuana, there is no charge. At our urgent care, for urgent care visits, there is a $25 copayment with our providers in Mexico and at our brand new hospital. Outside of the network, we also partnered with a few urgent care locations here in the San Diego County, where your copayment would be a $50 copayment because it would be with a provider outside of our network. Emergency room, there is a $250 copayment in Mexico, in or out of the plan area and in the US. However, if you visit the emergency room in the United States or in the San Diego County in a true medical emergency, if you are admitted into the hospital, that copayment, the $250 copayment is waived. Once the member is stable enough to be transferred, we stabilize the patient here at any of the hospital, whether it's in the San Diego County, we stabilize the patient. Once the patient is stabilized, then our medical operations team works with the case managers here in the US, and then we transfer over the patient in network to our hospitals at SIMNSA to continue the recovery and or treatment plan. For your short-term prescription drugs, there is a $10 copayment, and long-term prescription drugs are not available. Just to touch the real main focus is at the medical centers, again in Tijuana, in Mexicali, and Tecate. They're available. Being here closest to your network is our main campus in Tijuana, which is 2 minutes crossing the San Ysidro border. Our clinics are open 7 days a week. Our one-stop medical campus, where all your medical services can be rendered, where our hospital, again, is open 24 hours a day, 7 days a week. We also have telehealth appointments available with our SIMNSA doctors and specialists for your applicable copayment of $7. Please be sure to visit our telemedicina.simnsa.com or visit also our website, and you can also connect with your doctors. Thank you. Next slide. Now, to touch on the telehealth, get the care where you need, wherever you are. We have, in fact, improved access to care where it enables SIMNSA patients to connect with our healthcare professionals, receiving consultations and medical advice without the need to travel or wait long wait times for your $7 copay to see your PCP or your psychologist, any wellness visit as well. The convenience and time savings. These virtual appointments can be scheduled more flexibly, again, reducing the wait time and allowing patients to receive care from the comfort of your home. Continuity of care enables patients to maintain regular communications with our SIMNSA healthcare providers for follow-up visits, medication management, and monitoring of chronic conditions. And here is a flyer where it gives you just basic instructions of how to log in and how it works. Thank you. Next slide. Now, to touch on this very important point on maternity care for SIMNSA members. SIMNSA provides prenatal care in network for those who are going to have a baby. There's a $7 copayment involved for all your prenatal and postnatal visits, again, in network with our SIMNSA doctors. The delivery, including the cesarean section, the C-section, is a covered benefit in network at our SIMNSA hospitals or any of our contracted hospitals if we still actually contract there in the city. However, if you are pregnant, your baby, in fact, would need to be born in our SIMNSA hospital in Mexico. Our newborn, including well baby care, is also a covered benefit in network in Mexico. Members with questions regarding the immigration status of a newborn being born in Mexico would have to consult with an immigration attorney of their respective consulate or embassy for more information regarding a specific circumstance in regards to information on how to make that your baby a U.S. citizen. Out of network is a covered benefit in a true medical emergency. For example, if the mother, the SIMNSA member who is pregnant and is having a true medical emergency where they believe their water broke, and that would constitute as an emergency, and they can be seen here at a hospital. Again, keep in mind that they would be admitted if the attending physician here indicates that, you know what, the baby is not yet, it's not ready for the baby to be born. We all know that labor can be anywhere from 2 hours to 48 hours, depending on what the physician the attending physician in the U.S. hospital recommends. They would be advising our member if they would have to go in network for to see their gynecologist in that regard. Thank you. Next slide. Fantastic. For child-dependent sports physicals and vaccines, there is a $10 charge associated in network in Mexico in our SIMNSA medical facilities when a child-dependent needs a sports physical or a physical exam to participate in a school sport. In the U.S., unfortunately, this is not a covered benefit. However, they may be seen at a SIMNSA out-of-network urgent care location, and an applicable out-of-pocket cost would incur depending on a facility. I'm going to give you an example. My son plays sports. He's on the basketball team, and I use a specific urgent care location because, unfortunately, he tells me the very last day where that form needs to be turned into the school. So I choose to go, and every urgent care location has a specific out-of-pocket copayment. I paid $25 there at an urgent care. He got the physical, and then I was able to turn in that form there. The school forms must be presented to the attending physician, and the attending physician there will sign off the document. As far as vaccines, well child care and screenings and all periodic vaccinations are provided in network without any cost share on the member's part. Next slide. Fantastic. We really are proud to announce that we've built a SIMNSA Hospital Internacional. We've built a brand new hospital with over 160 beds, large and spacious beds, equipped with the latest advancements in healthcare technology, brand new infrastructure and medical equipment, where our hospitals are open again, 24 hours a day, 7 days a week. We have enhanced patient experience where our new hospital prioritizes patient-centered design and amenities, aiming to provide a comfortable and healing environment in our large and spacious patient rooms that you see there pictured. Again, we've also integrated digital solutions where SIMNSA Hospital provides seamless integration within our infrastructure, including telehealth capabilities, remote monitoring systems, and all doctors have access to our electronic health record systems. Thank you. Next slide. We've also listed our phone directory here where your health comes first. We have our 1-800 number, that 424-4652 that you see. That number is our customer service SIMNSA member line where we are open 24 hours a day, 7 days a week for a specific inquiry. If you want to speak to a nurse, schedule appointments. Or you can also call our administrative offices here at 619-407-4082 as well. And you will see a list of all our phone extensions here in Tijuana and Mexicali. We're available for our SIMNSA members 24 hours a day, 7 days a week for, again, scheduling of appointments, ensuring that our team is following protocols and best practices to better assist our SIMNSA patients. And I want to thank everyone for the opportunity to talk about our SIMNSA cross-border health plan. If you have any questions, I will remain on the line after the presentation with Matt as well to answer any questions. Thank you.
Thank you so much, Esmeralda. I really appreciate that presentation for your SIMNSA benefit plans. I'm going to talk to you a little bit more about your VIBA benefits that are available to you. So if you do decide to enroll into the SIMNSA plan, this automatically means that you're going to become a VIBA member. And in doing so, then you have some additional resources that are available to you and your covered dependents at no additional cost. So the newest benefit that we're going to be offering in 2024 is access to Kindbody. So right now, currently, there is no covered services for infertility solutions on the SIMNSA plan. But we are really excited to announce that SIMNSA members will now have access to Kindbody, which is a fertility solution benefit. As you know, fertility solutions can be quite costly. So they can range anywhere from treatments averaging up to $20,000. And then the actual procedures themselves can actually range upwards into the tens of thousands of dollars. So this is really a great opportunity for you to be able to have access to a fertility solution through Kindbody, where you will be able to have one full Kind cycle covered at 100% sponsored by VIBA. I'm going to talk a little bit more about what the Kind cycle is and what that entails, but we are really excited to roll this out in 2024 that you will have access to a fertility solution benefit through Kindbody. In the next slide, then Kindbody really does partner with you through all stages of life. So this could be anyone that is really wanting to just learn more about fertility solutions, you know, what infertility offers, all the way to post-fertility. So they really are a concierge service type company. They do a lot of hand-holding directly through the entire benefit. So, you know, this could be anyone who is just wanting to learn for fertility and how it works, all the way to the actual freezing of the eggs or the embryos, or sperm freezing. And then, you know, they're going to walk you through the entire family building process. They will go through, you know, if the individual, when they become pregnant, what they're able to do, as well as they'll be there right alongside you for the live birth. And then they really will help you with, you know, planning for your family. And then if there's any type of post-fertility resources needed, then they can go ahead and assist you too. So it really is a hand-holding experience where they really will be able to, you know, whatever process that you are in your fertility quest, they're really going to be there to handhold and walk you through the entire procedure. So where are the Kindbody locations? As you can see here, Kindbody is actually located all over California. But in San Diego area, then basically the Kindbody locations are going to vary. So basically, highlighted in yellow are their KindBody signature locations. So right now, we're excited to announce that because this is a brand new benefit for VIBA members, they are actually opening up 2 new signature locations sometime by the end of Q1 of 2024. I know one of those locations is going to be somewhere in the La Jolla area. I have not received the second location, but as we get more information, we will make sure to provide you with those resources. And then they also have partnered with some of the other clinics as well through San Diego Fertility Center. These include Del Mar, Mission Valley, Camino Real, and then they have the Reproductive Sciences Medical Center in San Diego as well. So if you are seeking fertility solutions and they do ask you to go to one of their clinics, they're going to refer you to the nearest clinic located to you. Not only are they here to provide you with fertility solution benefits, but they also can provide you with menopause. For those of you who have ever been through menopause, or if you are currently going through menopause, it's not a fun service. And so KindBody is also here to help you with any type of menopausal support that you would need. This could be including access to nutritionists, therapists, health coaches, and more. You can always schedule any type of virtual visits with them. There's hormone testing. There's prescription hormone therapy if it's needed. They can assist you with their holistic health solutions that are based on individual needs. You will always have access to their nurse practitioners. So they really are here to walk you through, anything regarding menopause. They can assist you through that entire process as well. And so who is eligible under the KindBody program? So basically, if you do enroll into the SIMNSA plan, then you will have access to 1 full kind cycle. So what does that mean, 1 full kind cycle? 1 full kind cycle is going to be, everything from the very beginning to where you're asking your questions, to the nurses all the way to post-fertility. So that could be anything, including the vitro and fertilization, also known as IVF or IUI. There's also, fertility medication, all the way through the live birth. They really are, that's considered 1 full kind cycle. That full kind cycle is going to be 100% sponsored by VIBA. Should you need an additional kind cycle or additional resources through the KindBody, then you will have access to do so. However, it will be at a discounted rate. In certain procedures, you can get that discounts of upwards to 20% off. So that first full kind cycle will be covered at 100% by VIBA, and then any additional procedures needed after, or if you need to use KindBody again, then it would be at a discounted rate. So we're really excited to announce that for the 2024 plan year. Our next available service that is available to you and your dependents at no cost is our access to our advocacy department. This is one of my favorite departments that I pretty much work with pretty much on a daily basis, because they're here to advocate for you, the members. Navigating the healthcare system can sometimes be quite difficult, and it's sometimes a little bit challenging to get answers to the questions that you may have. Maybe you received a bill and you're not exactly sure why, or you're having a hard time with access to care, or maybe the quality of care you're receiving, then you can always reach out to our advocacy department. Who they are is they're our in-house dedicated team. They're available Monday through Friday from 8 a.m. to 5 p.m. And they're here to advocate for you and get answers to those questions. So I've gone ahead, I've provided their information on the lower right-hand corner. You can reach out to them at the 800 number, or you can reach out via the QR code and ask whatever questions that you have pertaining to your health. This could be anything from, maybe you received a bill in the mail and you're not sure why. You thought it was covered under a certain copay. However, you're not sure why you're receiving this bill. Maybe you're transitioning to a new provider. Maybe you're considering accessing SIMNSA as your plan. Maybe you're coming from one of the other plans that's offered by the county, and you're thinking about enrolling into SIMNSA, and you really want to know, what it entails, everything that is affiliated with SIMNSA, then you can always reach out to our advocacy department. They can help you with, making any timely appointments, things like that. One example that I like to use that I've seen firsthand, I've had members actually standing in line trying to get their prescription, and for whatever reason, the pharmacist isn't able to pull up the member's information. Well, that member was able to step out of line, contact our advocacy department. Our advocacy department was then able to pull up the member's information, provide it to the pharmacist, and then get that prescription drug at the appropriate copay. So that's just one example of many that they can help you with. But if you do have any questions navigating the healthcare system, or you have any personal questions, please feel free to reach out to them. They are here for you, and all conversations are 100% confidential. The next benefit that you have available to you is through Teladoc Medical Experts. Teladoc Medical Experts, what this is it's a second opinion program. Maybe you have to go in for an aggressive surgery, or maybe you've been diagnosed with a chronic condition, and before undergoing any kind of treatment options, you want to get that second opinion. Well, that's exactly what Teladoc Medical Experts does. And it's really simple to get started. You would just simply call the 800 number that I've provided in the orange box, or you can start by going to their website. And then really what they're going to do is they're going to have a consultation with you about whatever it is that the type of treatment that you're going to be going through. Then after that consultation, they're going to, with your permission, work on accessing your medical records. You get to choose which medical records you would like to share, but this could be anything from, the conversations that you had with either your doctor or your specialist. This could be, any type of lab work you've had done. Maybe you've had x-rays or MRIs. They can have those transferred over. And then what they're going to do is they're going to take those records and they're going to send it up to one of their 50,000 world-renowned doctors. And they're going to find a doctor in the area of expertise of whatever it is that you're going through. So for example, let's just say I have to possibly have, like, let's say a knee replacement. And before I go ahead and I have knee surgery, I want to get that second opinion. Then they're going to send those medical records with my permission up to one of their world-renowned knee doctors. And that knee doctor is going to have a direct conversation with me, and they're going to let me know whatever diagnosis, prognosis, and treatment options are available. And so what it does is it allows you to get that second peace of mind. So they can even, those doctors, whatever it is that they see and find, they can even share that with your doctors. Maybe that surgery that I'm about to have, maybe it's an outdated surgery, or maybe surgery is not needed. So there could be an alternative form of treatment. And that, like I said, they can actually speak with your doctors as well. And so really, this is a service I hope that none of you ever need to have or utilize, but it is great if you do ever come across these type of situations, and it really does give you that second peace of mind so that you feel confident in whatever treatment option you decide to make. Not only do we want to care for you, but we want to care for your four-legged friends as well. So whether you have any canines or felines, then we have partnered with Inside RX Pets, where you can get certain types of medications at a discounted rate. So this could be anything from about 77% off of generic medications, and anywhere from about 15% discount on brand name medications. It's really easy to get started. You would just simply go to insiderxpets.com/pets. You're going to go ahead and register. And then once you've registered, then you'll be able to print out an ID card. Once you have that ID card, you can take it to one of their 40,000 participating pharmacies, and you can get a discount on the type of drug that your dog is or cat is being prescribed. Now, keep in mind, I have asked, unfortunately, flea medication is not included in this. However, if your pets are taking any type of prescription medications, there's a good chance that you could get it at a discount rate. They do have their formulary on their website, so if you want to go ahead and take a look at what medications, or if your medication qualifies at a discounted rate, you can go ahead and check that as well. But it's really easy. There's no sign-up fee or anything like that. You just simply print out that ID card and show it to the pharmacist and begin saving on certain medications. Finally, I'm going to talk to you here a little bit about the VIBA Resource Center. So the VIBA Resource Center was actually opened up back in 2019, and that was specifically for our VIBA members. We have 2 physical locations that are available to you. We have one in off Hotel Circle South, which is in Mission Valley. And then our second location is off Ruffin Road, which is about 1 square block away from the County of San Diego's main campus. So if you are at the County of San Diego's main campus, then our VIBA 2 location is located 1 city block east, I want to say, just right there off Ruffin Road. So it's pretty close to your main campus location. And really what the VIBA Resource Center is we wanted to provide individuals with the ability to work on whatever well-being challenges that they may have. This could be anything from physical challenges to mental to health, emotional, or even social challenges. And really, we are here to provide more of a holistic type approach towards healthcare and really help you with achieving your happiest and healthiest lives. So what is it that we offer at the VIBA Resource Center? We have different types of movement classes. We have stress management classes, cooking and nutrition, personal and professional development. So some of these classes that you would see would be like yoga or meditation. We have sound healing classes. There's all different types of stress management, deep breathing exercises. We even have massage chairs at the VIBA Resource Center as well. We have a actual cooking demonstration room. So it's kind of like a full kitchen where we can record our cooking and nutrition demos. So these are performed by our very own chef, Leslie. Somehow she takes bacon and is able to take broccoli and make it taste like bacon. I don't know how she does it, but it's absolutely fantastic. And then we have a lot of different workshops. Also in the VIBA Resource Center, there's gym equipment in there that you can use. So there's Stairmasters, ellipticals, there's weights that you can utilize. And then as I mentioned, there's the massage chairs. We have counseling session rooms for any type of group therapy as well. So there really is a lot to offer at the VIBA Resource Center. So we do encourage you to come and stop by, take a look at it. Feel free to use the equipment. All this is for you. It's at no cost to you. And as we go to our next slide, then basically we understand that sometimes maybe going to the VIBA Resource Center, maybe on a daily basis or a weekly basis, maybe even a monthly basis may be challenging. So we want to let you know that we also have a lot of virtual classes available to you as well. There's more than 200 different classes that we have each and every week, or each and every month, I'm sorry. And, you know, again, those are those yoga classes, those meditation classes, the healthy cooking demos. They're all recorded and archived. You can take part right from the comfort of your own home if you would like to. And with the virtual classes, you can actually share those with anyone. You can actually share those with your friends, your family members, your coworkers, share them with the people you like, share them with the people you don't like. It's fine. So you can absolutely utilize as many of our virtual content. You would just simply go to vibaresourcecenter.com. You can take a look at our full class schedule each and every month, and then you can go ahead and participate in as many as you want. Now, if you do want to utilize the services at the VIBA Resource Center, then you would need to be a VIBA member, meaning if you enroll into one of the counties into the SIMNSA plan, you automatically become a VIBA member and you will have access to these services. So as I mentioned, we have 2 brick and mortar buildings that you have the ability to come to. If you have any meetings, or maybe you have a group that wants to come and tour the facility or utilize the services as a group, maybe there's a bunch of you, then we are more than happy to have you. You know, please feel free, reach out to us, let us know that you would like to schedule a day, and then we will go ahead and provide you with lunch on that day, and you can tour the facility, see all the resources that it has to offer, even try some of the equipment if you would like to, and then feel free to use the VIBA resources or VIBA Resource Center at your convenience as well. So my apologies. Through the VIBA Resource Center, you also have access to one of our care navigators. Our care navigators are basically nurse practitioners. If you want more of that one-on-one type of consultation. So what our nurse navigators will do is work with you on whatever well-being challenges, and they're going to develop a strategy for you living your happiest and healthiest lives. And they're going to use that holistic approach, and they're going to develop a program that works right for you, that you can follow along with and set goals that are achievable for you so that you really can live your happiest and healthiest lives. So you do need to be a VIBA member to go ahead and utilize our care navigation program. Again, you can always go to our VIBA Resource Center website in order to access a care navigator at any time. And then finally, we also have a dedicated well-being team that is happy to bring well-being resources out to your site. We're excited to partner with United Healthcare and the County of San Diego on providing a lot of on-site well-being activities. So you may have seen on your campus, I want to say a couple weeks ago, where you guys had an inflatable obstacle course and a lot of well-being challenges. So we worked with the county and had a great partnership alongside with United Healthcare in order to go ahead and provide those type of resources and have those fun activities. And we continually engage with the County of San Diego's well-being department on a monthly basis, where we are here to provide on-site activities for your group. So if you have any additional well-being activities that you would like to have at your sites, maybe a healthy cooking demo, or maybe you want to have a yoga class that you have continually, feel free to reach out to us. I provided the website at Viba Resource Center /wellbeing, and feel free to utilize those services, and we'll be happy to bring any resources that we can out to your site locations. Don't just take it from us, take it from our members. I'm not going to read over the testimonials, but we really are making an impact on providing an alternative type of approach to healthcare when it comes to the Viva Resource Center. As you know, healthcare is not one size fits all. What works for one individual may not work for another individual. And so we really want to make sure that we work with you on an individual level to living your happiest and healthiest lives. So we get testimonials like this all the time, just thanking us for the services that we do, because your health matters to us. We want to help you become as healthy as possible. So again, please feel free to use the Viba Resource Center. It's no cost to you, and it is here for you, the members. So just before we go ahead and wrap up into our Q&A, then I just wanted to go ahead and provide some contact information. I went ahead and put in here the VIBA Advocacy Department. So if you do have questions regarding navigating the healthcare system, you can always go to vibaonline.com/contact to reach out to our advocacy department. Again, they're our in-house dedicated team to assist you with any questions that you may have. And then we have a lot of additional content at vibaonline.com as well. So I've also provided my slide here. So this is my contact information. Again, I am your dedicated account manager for the County of San Diego. So feel free to reach out with any questions that you may have. On the next slide, then we also have Heather Simonson, who is our VIBA ombudsman. She's also worked with us for quite some time, and she's here to assist you guys with any questions as well. With that being said, this does wrap up our presentation. So as we move to the next slide, we would like to go ahead and thank you guys so much for being here today. I'd like to go ahead and thank Esmeralda for being here on behalf of SIMNSA, and then also thank the County of San Diego for allowing us to be here as well to present to your group. At this time, we will go ahead and open up for questions, any questions that you may have. Both Esmeralda and I are here to help answer any questions. So thank you so much. Nidra, do we have some questions that came through in the chat while we were presenting?
Matt, nothing as of yet. Let's hang tight, and everyone, if you do have questions, we do encourage you to type it in the chat box. That way we can address all your concerns and questions as you make decisions regarding your plans and coverage for plan year 2024. All right, I see a little chat traffic coming through. One of the questions, if I currently have my kids insured, can I add SIMNSA as a second insurance?
Great question there. this is a great question. So, and I saw the second one. I'm currently enrolled in Kaiser, and SIMNSA has mental health plans. We'll go ahead and get to that too as well. But I believe this was a question that we had conversation with regards to possibly, having one member be enrolled in one plan, whereas possibly a spouse is enrolled into the SIMNSA plan. So whichever plan that your is primary, so whichever plan that the subscriber enrolls into will always be their primary plan. Now, with regards to the kids, and Esmeralda, maybe you can assist me with this one, is that from my understanding, primary insurance for the dependents, like the kids, is going to fall under the person who is of the oldest of age. Is that correct?
That is correct. Yes, correct.
Okay. So if you have two different plans, let's just say you have one individual on one type of plan, and then you yourself are enrolled into, let's say, the SIMNSA plan. You're both covering your kids, you're on different plans. Whoever's older, that is going to be the primary insurance for those dependent children. And then Esmeralda, we did get a question in here. It says, I'm currently enrolled in Kaiser, but does SIMNSA have any type of mental health service plans?
Yes, that is a great question. SIMNSA does have, we have our own mental health salud y bienestar department, where that, since COVID and the pandemic, we're seeing that this department grew. We've now have psychologists on our 4th floor. It's our dedicated department there on our medical campus. And we have, there is no referral that you need. You can see your psychologist directly, either virtually, or you can call, walk in with no appointment. So yes, we do in fact have that mental health plan with your applicable co-payment of $7, Matt. So that is a great question.
Gotcha. And then we're just following up on the question that we had previously. So maybe if I could get a little bit more clarification on what you mean by adding SIMNSA as a second insurance. Is that individual currently enrolled into a different medical plan through the County of San Diego? Okay, so the answer then would be no. Whichever plan you enroll into, then that's the plan that you would remain on. So I believe the county offers a Kaiser plan. There's some United Healthcare HMO plans that you can choose from, UMR PPO plan, and then the SIMNSA plan. So whichever plan you choose to enroll in is the plan that you're going to be in. So there's no secondary insurance. You can't pick one insurance. You can only pick one plan to be on, and then your dependents would fall under that plan as well. And then how about currently under Medi-Cal? That I'm not sure about. So, I mean, if you're able to access benefits directly through the County of San Diego, that would be your primary insurance, whichever plan you choose to enroll into.
Matt, how about if an employee and their spouse are currently covered under TRICARE? Could they, which is separate outside of the county, could they sign up for the SIMNSA plan as a county employee, although they have TRICARE, which is separate and outside of our parameters?
As long as the county allows them to go ahead and roll into the plan. So the only difference is you would have two people on two different types of plans. So if you have, let's just say, your spouse on, let's say, TRICARE, you're under TRICARE, and then you go ahead and enroll into one of the plans, we'll just say SIMNSA for this sake, then that subscriber who enrolled into SIMNSA, that's going to become their primary insurance. So they could actually be denied coverage through TRICARE and would have to actually seek services through SIMNSA because they're the subscriber into the SIMNSA plan. That becomes their primary insurance. So whichever plan you enroll into, that becomes your primary insurance. So because the two different plans, they don't coordinate together, so you can't just pick and choose, hey, I want to use these services for SIMNSA, and I would like to use these services for TRICARE. Even though you're covered under both plans, your primary plan, meaning the plan that you, the individual, enroll into, will become your primary insurance. The other insurance may deny you coverage simply because your primary insurance always takes precedence. So TRICARE, if you're the dependent on the TRICARE plan and you've enrolled into SIMNSA, SIMNSA becomes your primary plan. So that means TRICARE could potentially deny you for claims of services because they already see that you're enrolled as primary for your SIMNSA plan. I hope that helps kind of explain it.
Right. How about the question regarding kind body? Would an
Okay.
individual need to be enrolled in SIMNSA to take advantage of the kind body benefits?
Correct. So basically, the answer is yes. So you can either enroll into the SIMNSA plan, or you can enroll into any of the United Healthcare plans that are offered by the County of San Diego or the UMR PPO plan. The only plan that's excluded from this would be the Kaiser plan. But if you enroll into any of those other plans, you will have access to kind body. Great questions.
It looks like a little quietness for now. We'll hang tight to everyone to make sure we get all your questions addressed.
Nidra, this is Selena. Um, Everyone, I'm Selena and I'm a HR analyst with the benefits division. And I just wanted to go back to one of the slides that SIMNSA had presented on and just add a little bit of clarification regarding the health reimbursement account. Even though this slide states that it may look or appear that you wouldn't be eligible to have any excess flex credits or leftover flex credits go into a health reimbursement account. Here at the county, if you do have extra flex credits, meaning leftover flex credits after you've enrolled into your medical, dental, vision, and any other plans you choose here at the county, anything in excess would go to the health reimbursement account, or you could also choose to have it go to a dependent care account or a combination of the two. I just wanted to offer that clarification since this slide made it maybe appear that you couldn't have any excess flex credits go to a health reimbursement account.
Thank you for that clarification, Selena.
And then I've wanted to add to, I saw a couple of questions in the chat, and I'm familiar with some of these questions because I work with a lot of new employees, and I work with employees who are having life-changing events. And I see a question about Medi-Cal. And from my experience, when I have worked with people who have Medi-Cal and enroll in another plan, whether that is a SIMNSA plan or a Kaiser plan or a UHC plan, sometimes those employees do experience conflicts with Medi-Cal paying for the services. And then the employee, will contact us and then want to cancel their plans here at the county. And those aren't eligible qualifying life events. So you do definitely want to make sure you understand your Medi-Cal coverage and understand any other plan you may be enrolling in, because enrolling in a county plan can conflict with your Medi-Cal coverage, along with any services that may be provided to dependents you have enrolled on your plans. And what I mean by that is a very common scenario is an employee has a child who may be on the spectrum and they're receiving different services for that child. They enroll in one of the county plans, and then sometimes they experience conflict with those additional services that they were receiving through Medi-Cal for their child. So you definitely want to take the time to do your research prior to enrolling in any of our plans if you have a coverage through Medi-Cal.
For the individual requesting a copy of the PowerPoint, yes and no worries. We'll certainly be posting a copy of this presentation on the benefits website, and the PowerPoint will be available as well. Thank you for joining us, by the way. I'd like to remind everyone it's a lot of great information in today's webinar. And of course, if everything seemed like a blur from what you heard, we are accessible, meaning the benefits division and your departmental benefits ambassadors, to go over any details about the plan and questions that you may have after we resume this session. All right, we'll give it a couple of more minutes. And if there are no more questions, we will conclude the webinar. So please feel free to type your questions in the chat box. Alrighty, Matt or Esmeralda, can you help us with this question? Is there a high deductible option when choosing SIMNSA?
Esmeralda, I mean, I can go ahead and take this one. So no, there is not. So basically there's one SIMNSA plan to choose from. There is no deductible tied to this plan. And you would just simply pay copays. It's a very rich plan where your out-of-pocket costs for the time of services are considered very rich. So there is no deductible tied to this plan.
Thank you, Matt. That is correct. There is no deductible. As far as the second question there, does SIMNSA offer chiropractor services through our SIMNSA health plan? No, unfortunately not. We do offer acupuncture, however. We have massage therapy services as well for your applicable copayment of $10. Thank you. Matt,
do
did
you
you want to
know,
answer the
I was gonna say,
non-accounting?
well, I was gonna say, did you know if individuals who are not enrolled, can they just purchase the SIMNSA plan on their own?
So no, unfortunately not, Matt. We're a group health sponsor plan. We do not offer individual health plan policies. We are not licensed to do so, unfortunately. But that's a great question. Thank you.
Yeah, of course. And just to add on to that, so that means that your employer would need to offer SIMNSA as an offering in order
Correct.
to be able to enroll into that plan.
That is correct.
Matt, I'm going to go ahead and this is Selena again. I'm going to go ahead and go over the dual coverage option just one more time for the people who joined late, in case they fall into the situation, and it doesn't hurt to give an example or restate. And if I miss anything, please help me out. But
Of
one of
course.
the questions that came up was, if I'm a county employee and my spouse is also a county employee, or maybe my parent is a county employee, are they able to enroll our family onto, let's just say, the Kaiser HMO plan, and then I enroll the family onto the SIMNSA Mexico HMO plan? Can I do that? So technically, You could, but there's many considerations to make when making a choice that way. And so what we were trying to explain is that when you do something like that, let's just say my spouse is the person who enrolls the family. I enroll on the SIMNSA plan. SIMNSA now becomes my primary provider, right? So when I get sick and I have to go to the doctor, I have to go to a SIMNSA facility in order to seek care. I couldn't use my spouse's plan here necessarily because it's my secondary insurance and SIMNSA is my primary insurance. Then let's just say, you have a few children or one or two children also on the plan. Then it goes, okay, well, who's the primary for those children? Is it the Kaiser HMO plan or is it the SIMNSA plan? And that's going to be dependent on whose birthday is first. And I believe it's the actual month and day and not the year. Is that correct? Or is it?
Esmeralda, I believe that is correct.
Yes, that is correct.
Okay.
So if my spouse's birthday, for example, is in February and my birthday is in March, then the primary for the children would be my spouse's plan, right? Since my birthday falls after that one. So you just have to kind of think about that in context of whether or not dual coverage would be beneficial for your family. And I understand it's an attractive option, right? Because SIMNSA offers many benefits and Viva offers a lot of benefits, but you do want to think about that when enrolling in a plan and potentially considering dual coverage. And this would also fall even if your spouse was an accounting employee, maybe your spouse works somewhere else. I'll use myself as an example. My spouse works for the city of San Diego. So if I have a group plan through them, the same rules would apply even if I pick up a plan here with SIMNSA.
Esmeralda, we had another great question that came through, and that was great explanation, Selena. Appreciate the clarification. Esmeralda, does SIMNSA offer a medical lane pass to cross back to the US?
Yes, thank you, Matt. So yes, we do offer a dedicated medical lane pass when you see your doctor. All you have to do is go to our customer service desk and you will be asked to show your, the copy that you saw your doctor, and you pay a $5 fee to get that medical lane pass to cross back into the US, and that usually typically within 10 to 30, depending on the line there on the medical lane pass, you'll cross back a lot faster and avoid those long border wait times. So that is available, correct, Matt?
Thank you so much.
Sure. You're welcome.
I see another question coming through the chat. Individual joined late and is curious to know if we can run another session. Esmeralda, can we take it to the top of the presentation deck and we do another run just to make sure we capture everyone who joined late and hopefully get all their questions answered?
Yes, absolutely, of course.
Thank you.
Yeah, so we could go ahead and do another run through. So for those of you who joined late, then this will be the second session. So my name is Matt Ogden. I am your dedicated account manager for the County of San Diego. I work for California Schools VIBA. Today's agenda will be discussing the SIMNSA healthcare plan, along with the additional benefits that are available to you and your members, along with any VIBA contact and support resources. And then if you do have any questions, feel free to ask them at the end. So with that being said, I'd like to turn it over to Esmeralda Beltran, who will talk to you about your SIMNSA plan.
Thank you so much, Matt. Again, my name is Esmeralda Beltran, and I work for SIMNSA's health plan, where your health comes first as your dedicated account executive. Next slide. So for SIMNSA's HMO Mexican plan, we provide employees with a very affordable, very rich across-the-border health plan option, which in fact requires all your medical routine services be received in Mexico. Again, while true and emergency and urgent care services are in fact covered anywhere in the world, we have medical centers and medical campuses in Tijuana being our largest, Mexicali being our second largest, and Tecate being our smaller network there. SIMNSA is also subject to the healthcare reform mandate, which includes no co-payments for an extensive list of preventive care services, including other VIVA benefits that Matt will be able to talk about if we have a little bit more time about teledoc and the wellness programs as well. Thank you. Next slide. As far as SIMNSA's eligibility and who can join our Mexican HMO plan, the employees and their eligible dependents who live and or work in San Diego County or live in Tijuana and must meet the following definition of what a Mexican national is. That's it's a very broad term. Again, I'll list some of those examples of those who may enroll in our SIMNSA Mexican HMO plan. A person who was born in Mexico may join and enroll in SIMNSA's health plan. A person born in another country with a Mexican father or Mexican mother or both. I'll give you a good example. Myself, I was born here in Los Angeles, in the US. And because my mother and father are both Mexican, that automatically makes me a Mexican national. So that, therefore, I may enroll in the SIMNSA Mexican HMO plan. There is no supporting documentation that we require from the subscriber employee eligible dependent. Also, another person who can join is a foreign woman or man who marries a Mexican man or woman and who lives in Mexico, or a foreigner who becomes naturalized in Mexico can join our SIMNSA Mexican HMO plan. Thank you. Next slide. With our SIMNSA HMO plan, you can see in our website at www.simnsa.com how to see our network and our list of providers, our benefits summary, the evidence of coverage, some forms as well, a wellness information. We even have a wellness calendar where you can also go to our mental health talks or pláticas, we call them. And it's really great because you can also add those on your calendar as well to be able to be a part of those wellness talks. Thank you. Next slide. The SIMNSA HMO Mexican plan, what it does, this plan, it provides employees, again, with a very affordable across-the-border health plan in Mexico. We are licensed with the California Department of Managed Healthcare, subject to the Knox-Keene Act. All of those who join the SIMNSA Mexican HMO plan require that all your medical routine services, again, be received in Mexico, while true emergency and urgent cares are covered, again, in network and outside the network or anywhere in the world. We have medical centers in Tijuana, Mexicali, and Tecate. The plan is also subject to the healthcare reform mandate, including no co-payments for an extensive list of preventative care services, and including other VIVA benefits. Thank you. As far as the SIMNSA HMO plan, we call this plan that the County of San Diego offers their employees the 710-250. And here in the description, we have a benefit summary guide in which we indicate with the SIMNSA plan, there is no deductible. It is a very rich plan. The medical out-of-pocket maximum per individual is $6,350. The medical out-of-pocket maximum per family is $12,700. The RX out-of-pocket maximum is not applicable. On the health reimbursement account, Selena, I'm not sure if you want to touch or give you a touch base on this, since I know you did a really great explanation of how this plan works with the county?
Sure. So just for the health reimbursement account, many employees may be aware that the county doesn't cash out employees when they have unused flex credits or excess flex credits. Instead, they go to pay for any other plans that you choose here at the county, and then anything left over goes into something called a health reimbursement account. And you can use that account to pay for things like copays, prescriptions, over-the-counter medications, items like that. So even though this slide may indicate that there's not a health reimbursement account available, but here at the county, you will have any excess flex credits go into an HRA. So just an FYI that you are still eligible to have your flex credits go to the HRA when you have extra left over.
Wonderful. Thank you, Selena. Now, to continue, the PCP office visits and specialist office visits under the SIMNSA Mexican HMO plan have a $7 copayment. Preventative care has no copayment or no charge. As far as inpatient hospital care as well, it has no copayment, no charge. For urgent care in network in Mexico at our SIMNSA hospital, there's a $25 copayment with our providers, again, in Mexico. For urgent care, in the event that you cannot cross into our SIMNSA medical campus in Mexico, there is a $50 copayment where we actually contract with a list of non-participating providers, such as any urgent care. The most common ones that we use here are San Isidro Health, AFC Urgent Care, Mark Medical Centers. You can go to any urgent care. In the event that you cannot cross into Mexico to see your doctor, whether because you have a migraine, fever, and just giving you examples, diarrhea, something where it's not allowing you to cross into the border and see your a doctor. It seems a doctor, you would have to pay a $50 copayment, a provider outside of Mexico. For emergency, in the event in a true medical emergency, there is a $250 copayment associated with that visit in Mexico or out of the plan area in the US. However, if you are admitted into the hospital in the US, that copayment is in fact waived. Once the member is stable enough to be transferred, they have to stay overnight to run more tests. Once the member is stable enough to be transferred, if in the event they have surgery here, once the case manager works with our SIMNSA doctors and our medical operations team in Mexico, and then we also arrange the transfer for our SIMNSA member to be transferred to our hospital at SIMNSA in Mexico for recovery, treatment, etc. So I do want to make sure that is very clear. As far as short-term prescription drugs, there is a $10 copayment associated with the SIMNSA Mexican HMO plan, and long-term prescription drugs are not available. Just to reiterate again, our medical centers are in Mexico, in Tijuana, being our largest network, 2 minutes from the San Isidro border crossing. In Mexicali, again, that is our second largest network. That is the border of Calexico. If you happen to be there, you can also see your our SIMNSA doctors with your $7 and your applicable co-payments on your plan. Our clinics are open 7 days a week. Sometimes when I don't have an appointment, I go in as a walk-in and I see my doctor. Sometimes I wait a little, but I know that the clinic is open 7 days a week, Monday through Sunday from 8 a.m. to 10 p.m. and the hospital is open 24 hours a day, 7 days a week as well. Our one-stop medical campus is where all your medical services can be rendered. And we also have now telehealth appointments available with our SIMNSA doctors and specialists with your applicable copayment of your $7 if you visit telemedicina.simnsa.com. Thank you. Next slide. Just to give a little bit more insight about our telehealth, where you can receive the care you need wherever you are. We have improved access care where it enables our patients to connect with our healthcare professionals, receive consultations and medical advice without the need to travel and cross the border or wait long wait times for your $7 copayment. The convenience and time savings, of course, virtual appointments can be scheduled more flexibly, reducing your wait times, and allows patients to receive care from the comfort of their homes. Continuity of care enables our patients to maintain regular communications with our SIMNSA healthcare providers for follow-up visits, medication management, and just monitoring of any chronic conditions. Thank you. Maternity for SIMNSA members. SIMNSA provides prenatal care in network at our medical campus with the gynecologists. There is a $7 copayment for prenatal and postnatal visits. Now, the delivery, including a cesarean section, is a covered benefit for live births or scheduled against C-section at our SIMNSA Hospital Internacional in Mexico, or any other contracted hospitals in network, which we continue to work with as well. Our newborn, including well baby care, is also a covered benefit in network in Mexico. Our members, again, with questions regarding the immigration status of the newborns that were born at SIMNSA Hospital in Mexico, should consult with an immigration attorney or their respective consulate or embassy for more information regarding their specific circumstance to have their baby be a U.S. citizen, and how they get that documentation for the baby to cross the baby back into the U.S. As far as out of network, if you have a true medical emergency, that is a covered benefit in the event of a birth. For example, I know that when your water breaks, you may be the mother may be scared while pregnant, and they can, again, if she feels it is a true medical emergency, she can go to any hospital. There is that $250 copayment that is just, she would have to pay if the attending physician there at the hospital determines that it is a medical emergency and admits her, or they would have to, again, I'm not a doctor, they would have to evaluate each different circumstance or scenario for that pregnant mother. And sometimes, like we all know, when you go into labor, it can be anywhere from 2 hours to 24, 48 hours. So that all depends on the doctor that is attending that the pregnant mother at the hospital. Thank you. Next slide. As far as child dependence, sports, physicals, and vaccines, we know that all those are all coming up. I know that I am a sports mother. My son plays basketball. There is a $10 charge associated in network in Mexico when a child dependent needs a sports physical or a physical exam to participate in a school sport. In the U.S., this is not a covered benefit. They must go to a SIMNSA out of network urgent location if needed. And I know that my son last year, he gave me, I think, a day or two to go get his sports physical. And I said, I don't even have time. So I went to an urgent care location here, and they each location has their own out-of-pocket charge that incurs depending on a facility. I think I paid $25. However, with time, if needed, you need to schedule those appointments with our SIMNSA in network for that $10 charge associated to get that sports physical. The school forms must be presented to the attending physician, which will be signing off the form or the document. For vaccines, well child care and screenings and all periodic vaccinations are provided without any cost sharing on the member's part in network at our SIMNSA medical campus in Mexico. Next slide, thank you. Sorry, I'm out of breath. Now here in this slide, you'll see that SIMNSA we have our own SIMNSA Hospital Internacional, which we are proudly, it's actually probably the largest hospital now in Baja California. It's a brand new hospital with over 160 beds, designed and equipped with the latest advancements in healthcare technology, infrastructure, and medical equipment. They're performing surgeries there, open 24 hours a day, again, 7 days a week for our SIMNSA members. Their enhanced patient experience and our new hospital prioritizes patient-centered design, amenities. We really do aim to provide a comfortable and healing environment for our members. And as you can see they have large and spacious patient rooms with a brand new cafeteria as well, with really, really great food. Integration of digital solutions. SIMNSA Hospital provides seamless integration within our infrastructure, including telehealth capabilities, remote monitoring systems, and ICU, and electronic health record systems as well. Thank you. Next slide. I've also attached here a phone directory where you can call our SIMNSA customer member line at that 1-800 toll-free number 424-4652. We're open 24 hours a day, 7 days a week, as a nurse line as well, where you can consult, make appointments for our administrative Chula Vista office. You can call our 619-407-4082 if you need to walk in. If you have a bill that you receive from the hospital, an ambulance bill, you can come in, and also we can reprint a copy of your SIMNSA health insurance ID card. We're happy to do so. We are open here in our Chula Vista administrative offices from 8 a.m. to 5 p.m. And for scheduling of appointments, again, be sure to call that 1-800 number where our SIMNSA team follows protocols and best practices to better assist our SIMNSA patients. I want to thank you. I want to thank everyone for joining. Again, my name is Esmeralda Beltran as the account executive for SIMNSA's health plan. Thank you, Matt. I'll turn it over to you.
Thank you so much, Esmeralda. I appreciate all that information regarding SIMNSA. I'm just going to discuss with you a little bit about your additional benefits that you have. So if you enroll into the SIMNSA plan, this automatically means that you become a VIBA member. And being a VIBA member means you have additional benefits that are available to you and your dependents at no additional cost to you. Our first benefit that we would like to discuss is this is brand new for 2024 is the ability to have access to KindBody. KindBody is a fertility solution benefit. Currently in the SIMNSA plan, if you're enrolled into the SIMNSA plan, you do not have access to any type of fertility services. And you would actually, if you were looking for any type of infertility treatment, would have to pay 100% out of cost. And those costs can be quite expensive. That could be anywhere from about $20,000 for the treatments, and then the actual procedures to themselves can actually run into the tens of thousands of dollars. And so we're really excited to announce that we are partnering with KindBody, and you have the ability to get one full Kind cycle sponsored at 100% by VIBA. I will go into that a little bit more in additional slides here, but really KindBody is a concierge type service that really can help you, handhold you through all the stages of your fertility quest. I mean, this could be anywhere from someone who's calling up that wants to seek more information about, how KindBody works, what it entails, to the actual freezing of sperm and eggs, and when they actually mix the two together, they will assist you with any family type of building that you have when the person does become pregnant, all the way up through the live birth. And then if there's any post fertility that's needed as well, they can go ahead and assist you with that. So they're really great as far as hand holding you through the entire process of your fertility quest. Where they're located. So their signature clinics are listed here in yellow, and you can see here that they are located all over California. However, focusing in on the San Diego County, they are building 2 new KindBody locations sometime in the first quarter of 2024, specifically for VIBA members. So we will be able to disclose those locations once they've let us know. I believe one's in La Jolla. I'm not exactly sure where the other one is, but we will definitely let you know as soon as those locations have been sent over to us. However, they do partner with San Diego County's fertility centers. These are locations in Del Mar, Mission Valley, Camino Real, and their reproductive sciences medical center in San Diego. So if you are seeking fertility solutions, then basically you can always reach out to KindBody, and they will provide you with information on the nearest location where you can go to one of their clinics. Not only do they assist you with fertility solutions, they can also assist you with menopause. So if you are going through menopause, or you've been through menopause and you need any additional support, then they can assist you with that as well. Menopause is something that is quite difficult a lot of times for people to go through, and so they will be able to support you through the entire menopause process. This could be access to nutritionists, therapists, health coaches, and more. They will assist you with any type of virtual visits that you need assisting with, hormone testing. If there's any type of prescription drugs that are needed, they can assist you with, and then you'll have access to their nurses as well. So they really are here to handhold you through your menopausal process. So who's eligible for this benefit? So under the sponsored plans, then anybody who's enrolled into the United Healthcare plans, the UMR plans, or in this case, if you decide to enroll into SIMNSA or you're currently enrolled into SIMNSA, you will have access to this benefit beginning 1/1 of 2024. And you will have one full kind cycle that is sponsored by VIBA at 100%. Beginning in 2024. So what do I mean by a full kind cycle? Well, that's going to be anywhere from the consultations all the way to the actual appointments to the fertilization, so IVF, also IUI, as well as any post-fertility treatment. This will all be covered at 100% and sponsored by VIBA. Should you need to access an additional kind cycle or you need any type of additional services through Kindbody, you'll be able to do so, but it will be at a discounted rate. And different types of services will be receiving discounts of up to 20% off. So really great benefit where you will have that full first Kindbody cycle sponsored by VIBA, 100% covered for you and your family. Another great benefit that's available to you is our VIBA Advocacy Department. Our Advocacy Department is our in-house dedicated team to assist you with whatever questions that you may have. They're one of my favorite departments that I work with on a continual basis, and they're really here to advocate for you. Sometimes navigating the healthcare system can be quite difficult. You're contacting the carriers or your doctor's office, you're getting bounced around from phone tree to phone tree. You just can't seem to get the answers to your questions. Well, that's what the advocacy department is here for. They're our in-house dedicated team. They're available Monday through Friday from 8 a.m. to 5 p.m. I provided their contact information in the lower right-hand corner where you can call their 800 number, or you can reach out to them through our website or use the QR code. And then basically they can assist you with any type of questions that you may have. Maybe you're having problems with access to care or the quality of care that you're receiving, or maybe you're transitioning to a new provider. Maybe you're thinking about SIMNSA for the first time. You want a little more information. You need help with maybe finding doctors, things like that. They can assist you with that as well. Scheduling timely appointments. Maybe you received a bill in the mail and you're not exactly sure why. You thought it was covered under the plan. You can always reach out to our advocacy department. And one example that I like to use that I've seen firsthand with our advocacy department is I've actually had members standing in line at the pharmacy trying to pick up their prescriptions, and for whatever reason, the pharmacist is not able to pull up the member's information. Well, I've had the member step out of line, contact our advocacy department, in which case the advocacy department was able to pull up the information, provide it to the pharmacist, and that member was able to get their prescription at an appropriate copay. That's just one example of many, but they really are here to advocate for you with any questions that you have. Teladoc Medical Experts is also included if you enroll into the SIMNSA plan, and basically this is a second opinion program. Maybe you have to go in for an aggressive surgery, or maybe you've been diagnosed with a chronic condition, and before undergoing any type of treatment, maybe you want to get that second opinion. And so that's exactly what Teladoc Medical Experts does, is they provide you with that second peace of mind. The way that it works is you would just simply go to their 800 number, you can visit their website, and you're going to have a consultation about whatever it is that you're going through. And through that consultation, then at that point, they're going to ask about getting access to your medical records. So with your permission, you can share the medical records that you would like to share with them. And this could be anything from, consultations that you've had with your doctor, your physician, or your specialist, to the recommended treatment options. They could talk to you, or they could work on getting your lab work, your x-rays, your MRI scans, things like that as well. And then what they're going to do is they're going to take that information, they're going to send it up to one of their world-renowned doctors. They have over 50,000 world-renowned doctors that are part of Teladoc Medical Experts. They're going to find a doctor in the area of expertise of whatever it is you're going through. I'll go ahead and use an example. Maybe I need to have a knee replacement, and before I go ahead and I get that knee replacement, I want to get that second opinion. So I go ahead, I provide my medical information, my MRI scans, and what they'll do is they'll send it up to one of their world-renowned doctors. They're going to find a knee doctor who specializes in knee replacements, and I'll have communication with him. And that doctor will let me know if I'm getting the right diagnosis, the right prognosis, the right treatment options that are available to you. You know, maybe that surgery that I'm about to have, maybe it's an outdated surgery, or maybe surgery is not needed and there's an alternative form of treatment. Then basically what they can do is they can recommend alternative forms of treatment. They can even speak with your doctors as well. But what it really does is it gives you that second peace of mind. So when you do decide to go through whatever treatment option it is, you'll feel confident knowing that you're making the right decision. And so that is included if you enroll into the SIMNSA plan. It's at no cost to you and your covered dependents. Not only do we want to take care of you, but we want to take care of your four-legged friends as well. So if you have any dogs or cats and they're on any type of medications, there's a good chance that they could save on their prescription medications. You can see anywhere from a 77% savings on generic medications and up to 15% on any type of brand medications. It's really easy to get started. You can just simply go to insiderxpets.com/pets to get started. You're going to go ahead and create an account. You'll be able to print out an ID card, and then you would just simply take it to one of their 40,000 participating pharmacies. Now, I have checked. Unfortunately, flea medication is not included as one of the covered medications. However, there are a lot of different types of medications. You can always visit the formulary on their website as well. And then if your dog or cat is taking any medications, then there is a good chance they could get it at a discounted rate. Finally, I'm just going to touch base here on the VIBA Resource Center. So the VIBA Resource Center was a place where we opened up way back in 2019 for folks to be able to receive I'm sorry, I got a little tongue-tied there. So they're able to assist with, you know, any type of well-being challenges that you may have, whether it's physical, mental, social, emotional, doesn't matter. And so basically the VIBA Resource Center, we opened it up. We have two different locations. One's in Kearney Mesa, right off Ruffin Road. It's about one city block east of the County of San Diego's main campus, so really close. And then we have our original location is in Mission Valley off Hotel Circle South. So as we move to the next slide, what can you expect to see at the VIBA Resource Center? So we have all different kinds of classes that you can take part in. We have different rooms. We have consultation rooms. We actually have gym equipment in there like ellipticals. We have Stairmasters. We have weights in there that are all available to you at no cost that you can utilize at whenever you would like to. And then we have different types of movement classes, stress management classes, cooking and nutrition classes, and personal and professional development. So some of these classes would include like yoga classes, meditation classes, there's sound healing classes, there's stress management with, if you've ever wanted to try acupuncture, you can try acupuncture, acupressure at our VIBA Resource Center location, as well as different types of meditation sessions. And then we have a cooking kitchen in there as well, where we do cooking demonstrations, where you can actually take part in one of our healthy cooking demos performed by our very own Chef Leslie. And so also we understand that maybe you're not able to go ahead and participate in the class or go to the VIBA Resource Center maybe on a daily basis or weekly basis or even a monthly basis. So we have provided a lot of our classes virtually as well. You can take part in as many of these classes as you want to. We offer more than 200 different classes each and every month that you can go ahead and take part in. The only one being, I believe, acupuncture, just simply because you can't have acupuncture through a video visit, but a lot of our other content is on our virtual classes. Feel free to share those with as many people as you like. Share them with your friends, your family, your neighbors, you know, all of your friends, your coworkers. So feel free to share those classes, the virtual content. However, if you do want to access any in-person classes, you will need to be a VIBA member. And then, as I mentioned, we had 2 physical locations, but if you ever want to come tour the facility, maybe you want to have a meeting there or anything like that, we would love to have you. Feel free to come, reach out to us. We'll schedule a day where you can come tour the facility, see all the equipment that's available to you, all the resources, and then go ahead and, we'll provide you with lunch. And if you need a meeting, you can definitely have that meeting as well. You'll also have access to our Care Navigator programs through the VIBA Resource Center. Basically, these are nurse practitioners, and it's really for someone that really wants to have kind of more of a one-on-one consultation for any type of well-being challenges that they may have. And what they're going to do is they're going to work with you individually to help you achieve your well-being goals. And they're going to set goals that are absolutely achievable for you. They're 100% holistic, and really they're here to help you live your happiest and healthiest lives. Because as you know, healthcare is not one size fits all. What works for one individual may not work for another individual. So we want to make sure that we are providing you with solutions to helping you achieve your overall happiest lives. And then also we have a dedicated well-being team where we can go ahead and bring well-being resources out to you, the members. And so we're really excited to be able to partner with the County of San Diego and alongside with United Healthcare, where we do bring a lot of well-being resources out to your site locations. I believe as of last week, there was a type of inflatable obstacle course that we helped promote with the County of San Diego and United Healthcare as well. So we do a lot of fun well-being activities as well. So if you are looking for additional well-being activities, maybe yoga classes or cooking demos, we would be able to assist you with that as well. So we are really happy to partner with the County of San Diego on a continual basis in promoting on-site well-being activity at your site locations. And then don't just take it from us, take it from our members. We have a lot of member testimonials where we've been able to help them. I'm not going to read each one of these individually, but I do want to let you know that, we do love to hear positive feedback from our members about utilizing the resources at the VIBA Resource Center, and really the amount, so many lives that we've been able to touch and help improve. With that being said, I'm just going to wrap up by providing our contact information. So again, I've provided our advocacy department. So if you have any questions about your healthcare, then you can always reach out to our advocacy department. I've provided their phone number again. And then we have a lot of additional content at vibaonline.com. And here is my account information. Again, my name is Matt Ogden. I am your dedicated account manager, so feel free to reach out with any questions that you may have. And then Heather Simonson is our VIBA ombudsman, who is on our next slide. She has also worked with us for quite some time, and she is able to assist with any questions that you may have as well. With that being said, thank you so much. This does conclude our presentation. Again, I would like to thank Esmeralda Beltran from SIMNSA for providing all of the information regarding the SIMNSA plan, and then thanking the County of San Diego for allowing us to be here to present today. So thank you, and feel free to reach out with any questions you may have.
All right. Before we wrap it up, I would like to share a couple of questions that did come through the chat. Regarding medications, are there any restrictions when you're crossing the border with the prescription medications? So I'm assuming if you go across the border to one of the SIMNSA medical facilities in Tijuana and you return back, are there any restrictions? Esmeralda, can you assist us with that question?
Absolutely, that is a great question. So no, there are no restrictions crossing the border as long as you have your prescription and that you have your SIMNSA health insurance ID card, and say you went across the border to see your medical provider, there should not be a problem.
Okay, thank you. I believe I can answer the next question. It is regarding flex credits. Are we able to use flex credits for medications purchased at SIMNSA? And this is likely to actually be your HRA account or your flexible spending account, as your flex credits are actually the monies that the county gives you to use towards the purchase of your benefits. So to answer that question, you can use your flexible spending account and your HRA However, what would need to happen, you would pay out of pocket and then you would submit your claim and a receipt to ASI Flex as they are separate from SIMNSA to seek reimbursement for any of your medication costs. Let's see, one more question here. Can Kaiser members access the VIBA Center for free or at a discounted rate?
Great question. So Kaiser members can access our virtual classes if you want. Because Kaiser does not fall under VIBA, Kaiser members are technically not VIBA members. However, if you do want to access our virtual classes, then you can feel free to do so. You can go to vibaresourcecenter.com and sign up for any classes that you would like to go ahead and take part in right from the comfort of your own home. But the actual VIBA Resource Center is only available for VIBA members, and unfortunately, Kaiser does not fall under a VIBA member. Great question, though.
Very good questions.
And then this is Selena, and thanks, Matt, for adding about that, the virtual option. I didn't know that myself. And then for Argelia, the person who asked the question, Kaiser does offer something similar. I can send you the link to it, and I'm not trying to steal the light from Viva or anything, but
Not at all.
just want to let you know that that as a Kaiser member, there is something similar to the Viva Resource Center that Kaiser offers. And I only mentioned that because I'm speaking on behalf of the County of San Diego, so just trying to look out for the employees' options and resources.
Absolutely. Thank you, Selena.
Right. I believe we've answered every question. I would like to thank Matt and Esmeralda for the wonderful presentation. Thank all the employees who made time to be present and gather all this detailed information. I believe this does conclude the webinar. Thanks again, everyone, for joining us, and have a great day.
Thank you, everybody.
Thank you, everyone. Have a good rest of your day. Bye-bye.